is Handsome ASMR back with another video. This time we're going to be talking about the different routes of drug administration. And so it is so important to realize that having a thorough understanding of these different routes of drug administration can help guide your treatment decision when a patient is afflicted with a certain disease, condition, disorder, etc. Overall, these routes can be broadly categorized into enteral, parenteral, topical, or other subspecialized routes. So in this video, I'm going to break them down. So the first route we have is called the enteral route, and this will occur via the gastrointestinal tract. There are several forms of it, the most common being the oral route, also known as PO or per os. This is the most common and convenient drug administration route, and in this route, the absorption will occur primarily in the small intestine. However, you have to consider the first pass metabolism effect that occurs in the liver, because this will actually reduce the bioavailability of the drug, or the amount of drug that is effective, that is present in the body. I'll explain more about this later, probably in a future video. But anyways, the benefits of this route is that it is safe, easy, and economical. But the downside is that the drug will have a slower onset, and it is also not suitable with vomiting, which makes sense. And it is unconscious, or if anyone has a gastrointestinal disorder, they should not be administered a drug via this route. So once again, if a patient is vomiting, if they're unconscious, or if they have a GI disorder, they should not be given a drug through the oral route. The second route we have is the sublingual or buccal route. This is where the drug is placed under the tongue, and one classic example of this is a nitroglycerin, which is used to help vasodilate the blood vessels in cases of myocardial infarction or heart attack. So the buccal means between the gum and the cheek, and the absorption in this case is rapid through the mucosa and will actually bypass the first pass metabolism, making this quite different from the oral route. One benefit of this is that it has rapid onset, and another important benefit is that it avoids liver metabolism, aka first pass metabolism. On the other hand, you can only administer small doses, and it is not suitable for any drugs that can potentially irritate the mucosa or the skin. And then the third enteral route we have is called the rectal route, or PR, or per rectum. This route allows partial avoidance of the first pass metabolism, and unlike the oral route, it can be useful in unconscious or vomiting patients. So one benefit of this is that it can be used when the oral route is not feasible. On the other hand, it should not be used, or the disadvantage is that it can be an erratic form of absorption, and a patient may not feel comfortable receiving the drug through this route. So always consider this. Now we can talk about the parenteral routes, or routes that bypass the GI tract. These are some more common sets of drug administration, or the routes of them. So the first route we have is the IV or intravenous route. So this route involves administering the drug directly into the bloodstream. It has an immediate onset with 100% bioavailability, so it's good. And so, along those lines, the benefits are that it is precise, rapid, and good for emergency drugs. highly skilled personnel in order to administer the drug through this route. We also have the intramuscular route, where drug is injected into the muscle, such as on the patient's deltoid or gluteus muscles. Deltoid being on the patient's upper arm, gluteus being on the patient's butt cheeks. Alright, so, and then the absorption depends on the blood flow and formulation. The benefits of this route of drug administration is that it has longer duration than the intravenous route, and is suitable for debit preparations. On the other hand, it is painful. There is a risk of nerve damage, and it should not be used for anticoagulated patients. So always remember that. You have your subcutaneous route, where drug is injected into the fatty layer that is located under the skin. It has slower onset than the intramuscular, but it can be used for insulin or another drug like heparin. The benefit of this is that it is suitable for self-administration, but the problem is that it can only have limited volume and there's risk of skin irritation. We also have the intradermal route, another classic parenteral route. This is where drug is administered into the dermis, or a TB test is another example. So one benefit of it is that it can be a clinically useful tool for diagnostic purposes. It also has slow absorption. On the other hand, only small volumes can be administered at a time. And then finally we have intraarterial or intrathecal or intraosseous routes. These are specialized high-risk routes. The intraarterial routes are for chemotherapy or for killing localized tumors. Intrathecal routes involves administering drug into the cerebrospinal fluid, such as for spinal anesthesia. And then the intraosseous route is for emergency purposes when the intravenous route fails. Finally, we have the topical and transdermal routes. Many of you might be familiar with the topical route because it involves direct application of the drug to the skin or mucosa, such as treating acne. And so creams and ointments are common for those. They mostly have a local effect, so you have minimal systemic absorption. And once again, examples of these include the antibiotic creams or corticosteroids. We also have the transdermal route, where drug is absorbed through the skin into the bloodstream. That's what makes it different from the topical route. So nicotine patch and even fentanyl can be examples of them. There is sustained release in this route, and you can also avoid the first pass effect. Benefit of this is that it can be a long duration form of administration, where the drug can have its long durational effect. It is also convenient. However, this route is limited to potent drugs, and skin irritation can once again be possible. And finally, we have the ophthalmic or otic or nasal routes. These are specialized in that it involves local treatment of the eye, so ophthalmic, ear, or otic, or nasal or nose conditions. Nasal routes can also be systemic. So examples of these include a desmopressin, or for conducting a cortisol function test, or naloxone, or to reverse the toxic effects of opioid. And then we also have some inhalational routes, which are pretty convenient. So the drugs for these include gas, vapor, aerosol. They will have rapid onset due to large surface area and blood supply of lungs. drugs. Examples of these include your anesthetics or beta-2 agonist, such as salbutamol, which is a bronchodilator. The benefits of these is that it's a quick-action drug. It can be localized, and that it can only target the lungs. However, this route is technique dependent, and it can result in possible systemic effects. Finally, we have some other routes that may or may not be important to know, but it's good to know that they exist. So the vaginal route can be useful for localized treatment, such as in treating antifungal, or for antifungal pessaries is one example. It can be systemic in rare cases, so watch out for that. You also have implants, where you have drug-releasing devices placed subcutaneously. And benefit of this is that it can facilitate long-term drug release, so contraceptive implants are one example of them. And then your intranasal routes, so this involves direct access to systemic circulation, or even the central nervous system via the olfactory nerves, which are located underneath your olfactory bulb and the cribriform plate of your skull. So, when considering the different types of drug administration, just consider the following factors. Consider the patient condition, whether they're unconscious, vomiting, whether they're a child or an old person. Consider the drug properties such as solubility, stability, or irritancy. Consider the onset and the duration that would be required to provide effective treatment. Also, the site of action, whether the pathogen or any other factor that's causing the disease is more localized or more systemic. And lastly, consider the convenience and compliance for these drug administrations. So just to review, remember that if you want to provide drug to a vomiting or unconscious patient, avoid the oral route at all costs, and instead consider the rectal route. But if the patient is conscious and would feel discomfort in this route, then you might as well switch to the oral route or the sublingual route if you want to avoid first pass metabolism. So understanding the drug mechanism in addition to these different possible routes will be the key to providing effective treatments for your patients. So that is all for today with this ASMR educational lecture. Feel free to comment down below any questions or corrections that need to be made, and I will see you next time.